It was probably the easiest decision we had to make.
You determine what services you need for your family.
It's not like a hospital, it's not like a nursing home, it's like an extension of your home.
Extremely compassionate, very understanding.
It's such a loving atmosphere.
Just took away the question and the being scared, and he had someone to relate those issues with every day.
Challenging journeys are more difficult when made alone. In the mid-70s, the concept of end-of-life care was changing. How one finished life's journey was becoming just as important as how one began it. The hospice movement was emerging, and the communities of North Central Florida were among the first to embrace it. They wanted to make sure that no one had to make this challenging journey alone.
Really is an incredible story. The organization began in this very small office in Alachua General Hospital with a paid nurse and a volunteer that answered the phones.
We started the hospice program, the idea of it, in '78 when I was chief of staff the first time.
We had just a little board there and one or two nurses, and started from a closed closet and went from there.
We were trying to get the perception of, isn't there a better way to take care of people that are dying? I mean, that was a simple concept, and we found it.
Laura Carmichael, the only way to describe Laura is she's a treasure. And she was an integral part. She was on our board.
Alice Sharp and the hospital auxiliary added the spark because they put the first money into the program. I describe Faye Knight, I've never had the opportunity to describe it to her, but she was just an angel in the sense that she did so much without any recognition. I mean, she participated by going to the homes of hospice patients. That's where the rubber hits the road.
I never really believed that it would be as large as it is today. And, you know, this building bears the name of E.T. York, who was a member of our board for many years and is a wonderful asset to this community.
Hospice is the only organization I've ever been associated with about which you never hear a negative word.
In 1996, we developed and opened the E.T. York Hospice Care Center. And what we heard from individuals and families that used it was that it was a wonderful facility. But it's really too bad that we have to travel 2-3 hours to get there. The board of directors heard this, and they made the strategic decision to move forward with building care centers in Palatka and Chiefland. Most recently, we have expanded our effort to build a care center to serve the Swanee Valley area in Lake City.
Today, we travel with more than 3,000 patients and their families each year on their journeys. We've grown not only in the number of people we serve, but also in the breadth and scope of our services. In addition to hospice care, we now offer specialized home care and medical equipment services. We support caregivers and help people cope with the onset of serious illness. We help children cope with grief and young mothers cope with the loss of their babies.
The mission is really to be with people, to be with them on a very challenging journey, to meet their needs holistically, physically, spiritually, and emotionally. We have a fancier, more wordy mission, but when you peel back the onion, that's really what's left, is us being with people, living life with them and their family at a very challenging point in time.
He asked me to marry him when he found out that he had cancer. He said, well, you know, I want to go ahead and do this and have you be left as my wife and not my girlfriend. And of course, that's what I wanted to. Our hospice nurses found out that we wanted to be married, and they went beyond doing what they needed to do to make us happy. They would come to me and they would say, Misty, what do you want? You know, what colors do you want your flowers? What colors do you want your girls' dresses? What jewelry do you want to wear? They came all dressed up, which it was great to see them in something besides their nurse's uniform. We all just acted like friends for the day and just had a really good day, peaceful day, great day.
Quita was diagnosed with astrocytoma, which is a brain tumor. They have a nurse that comes out and assists Quita with her medical needs. They are loving, they're kind, they show great hospitality when they come. But I didn't expect nursing assistant, I didn't expect, dietary assistant. I didn't expect, that to be working with the doctor so closely, I didn't expect to have, services available to me 24 hours a day, 7 days a week. So, and especially the respite services that they provide. I didn't expect all these services. So that's why it's so wonderful, because I know that any time that I need assistance, hospice is there.
I'm the mother of Noah Jacob, who was stillborn at 41 weeks. We came home from the hospital and we were surrounded by our friends, and our family came and they were very supportive, but we knew at some point they were going to leave and we were going to really be faced with the reality of being in this house that had all of this stuff for a baby and no baby. My perspective was that hospice helped people who were in a situation where they were dying, not after they had already passed away. And so it wasn't something that really had dawned on us, maybe the call here. But I think too, being able to grieve with other parents and to share that experience with other parents. And that's what hospice provided for us.
My wife, she had stage 4 cancer. She had begun the process with hospice probably a year before she died. Joan, in talking to somebody, had said she wanted to see snow one more time. We're from Michigan. The kids made contact and arranged for the snow machine to be brought out here. Sandy and staff had made hot chocolate, and I think the kids made cookies, so we were able to take Joan out on the back porch in a wheelchair, and so she got her dying wish to see snow again. It's not just where they're trained to help people die. They're trained to help the survivors live.
Trey was diagnosed with leukemia. We wanted what was best for him and best for us, and to keep all of us together as a family. It was just nice to be home. I can't tell you, because I spent a lot of time in the hospital with him, and it's just not home. So, gives home a new meaning.
When they came, they didn't treat him like a patient. They just, they would come and play with him and take him outside and swing with him, and hospice was really great as far as, we could call either the nurse or the counselor at any time and they would come, right then. They helped arrange
it's just
the fire
hard.
Truck and everything came out.
It was nice to have him home and to have that. When you have nothing left to give somebody, peace and dignity and things like that, it was huge for it to be at home, where he would want it to be. So.
All journeys aren't the same. Haven Hospice staff and volunteers will be there wherever a person's journey leads, because they have a calling to care for those facing difficult times.
The comments I hear from people around the community are really around gratitude. Gratitude for what the staff has done, what the volunteers have done, what it has meant to them. And I think that's very unique. Certainly the dedicated and committed philosophy of the staff and the volunteers. They really are incredible professionals. They don't come to the organization just for a paycheck, and certainly the volunteers don't just come to the organization to spend some time.
It's really a gift to be able to volunteer for a program like hospice. I get back so much more than I give.
Volunteers contribute in a whole host of ways, from being at the bedside, providing respite and relief to family members, and keeping patients company. And we also have volunteers that actually just help us in the office with clerical and administrative functions. We have a whole other host of volunteers that help us in fundraising efforts and events. And then we have these hospice addicts, which we affectionately refer to as upscale resale.
I sold a woman a pair of bedroom shoes for 50 cents. And she gave me $50 and said, I don't want any change. Hospice took care of my dad. I don't know of any other program that generates that kind of response from the people who are helped.
As we move forward, these services will continue to expand as part of our deep commitment to meeting people earlier in their journey.
Ultimately, down the road, it's really difficult to say where will this organization be. Just as I'm sure it was difficult for those folks in that small room to imagine where we are today, it's impossible for me to imagine where we would be 25 or 50 years from now. But I guess we haven't achieved our ultimate goal. If there is one person in our community who is facing the end of life, who doesn't know about us, who doesn't know about our service, who doesn't have the ability to access what we can do for them, until we get to that person, we truly haven't accomplished our goal and our mission. But we certainly are making a big difference along the way.
I would say for someone who's in a situation where they're trying to take care of a terminal loved one, that should be your only choice, is to go with hospice.